So I wanted to just expand a little bit on this idea of adult craniofacial growth, and I'm going to go to the board here just to illustrate a couple of points. So if we're talking about adult craniofacial growth, and we want to look at the nose, upper lip, lower lip, and the chin, okay? Put an eye here. And what we're talking about is that growth is occurring in the adult years on the order of 1 to 2 millimeters over a decade. So whereas teenagers might grow 1 to 2 millimeters over a 6-month period, adults are growing much slower. For example, the upper lip is headed down, lower lip, chin, nose. Obviously we know that nose tends to get more prominent over time. And we see the soft tissues changing in this way, but what Dr. Behrens was able to show was that in fact the hard tissues are also changing. And the important point that I was making before was that if we look at the position of the upper incisor, that the rate of change of the lip is greater than the rate of change at the incisor. So over time, the lip is growing more than the teeth. So you're going to show less incisor when you smile as you get older. Other point that I made was that males and females are going to grow differently. The males are going to have more horizontal mandibular growth, and females are going to have more vertical growth. It's a basic difference between men and women over the long haul, over the long term, after age 20, after age 21. Last point I wanted to illustrate, and we talked about this in the first section, and that is what's happening with sort of the single tooth dental implant. So here we have an upper right central incisor, we'll call that number 8, okay? And then next to this tooth, we've got a dental implant. Now, these two teeth in an adult, say 25 years of age, we might see over the next 10 years, 25 to 35 years. The normal vertical growth now of the face might only be 1 millimeter. But that 1 millimeter of growth is definitely something that you're going to be able to see on someone's smile. So adult facial growth, when we talk about these small changes in teeth, can be clinically significant. Another area where you might see clinical significance in the same time frame, imagine now you've got a natural molar occluding against a dental implant. And we said that the mandible is growing down and forward, maybe at a level of 1 to 2 millimeters over 10 to 20 years. What's going to happen to the occlusion if you've got natural teeth on both sides of a dental implant at age 25 versus at age 35? If this is at age 25, when you look at this again at age 35, what are you likely to see? Well, implant doesn't move. And the other teeth are able to drift, which we learned last time is the movement of teeth within the bones after they've reached the level of the occlusal plane. So the natural teeth are able to undergo drift, but the implant doesn't, and so you end up with this gap in the occlusion. And knowing that people can feel the occlusion down to about 1/10 of a millimeter, a 1 millimeter gap in their posterior occlusion would be something you would definitely notice. So it's these sorts of small changes that I think do have clinical importance in dentistry, especially as now we're starting to do these single tooth dental implants. And that's probably one of the most clinically significant areas for adult craniofacial growth. It's something that you should pay attention to throughout your dental practice lifetime. Thanks.